Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Kelly, and good afternoon, everyone. As you can see, I'm not in the office today. I'm speaking from home because I was exposed to someone who tested positive for COVID-19. As a result, I was tested yesterday and the results came back negative. Still, because of that contact, I need to continue to self-quarantine and will be tested again next week. I mentioned this not to focus on myself, but to remind everyone that the risk of COVID-19 are still very much with us. I'm thankful that Philadelphia's positive case numbers have dropped and that we've been able to ease many of the restrictions imposed earlier this year. But the virus is still here and we must remain vigilant. So if you find yourself in a similar situation, exposed to someone who tests positive, do the right thing and self-quarantine and get yourself tested, because this pandemic, unfortunately, is far from over. To shift gears now, I want to highlight that today is National Voter Registration Day. This is a nonpartisan civic holiday and coalition that celebrates voter registration and voter engagement, first observed in 2012. The National Voter Registration Day efforts have helped 3 million voters register nationwide since its inception. And of course, this year, the effort couldn't be more important. Our own Office of Youth Engagement recently launched its youth-led voter registration initiative as part of the First Vote 2020, a coordinated voter education and registration effort geared toward engaging young people in the lead up to the election. The youth engagement team has developed an innovative way for our young people to engage community members while maintaining proper social distancing and other safety measures. First Vote 2020 ambassadors will be able to direct individuals to QR codes on the back of their branded T-shirts that will not only take users to Pennsylvania's voter registration application, but also the application for a mail-in ballot. Remember that in Pennsylvania, the deadline to register to vote is October 19th. That may seem like you have plenty of time, but folks, you really should not wait. You should get that done right away. And if you plan on requesting a mail-in ballot, it is especially important to get registered sooner than later, so you can request that ballot early. You can check your voter registration status and register to vote by visiting votespa.com. That's votespa.com. Now I want to offer an update on a topic that affects every home in the city, and that is residential trash and recycling collection. I'm happy to report the collections have been on schedule for the past few weeks, and we plan to keep it that way. I want to thank our dedicated sanitation workers and the leadership of the Streets Department for navigating through these unprecedented times. Clean and safe streets are one of our residents' top priorities. That is why we're excited to announce a new public-facing tool that provides direct access to the city's residential sanitation services. PickupPHL is a new web map that allows residents to view and track the status of trash and recycling collections. With PickupPHL, residents will have almost real-time access to track when their block will be picked up. This is a new tool, further demonstrates our administration's commitment to transparency and accountability in city services. When PickupPHL launches next week, it will be the first time the public will be able to access the status of the collections online. And now I would like to turn this over to Carlton Williams, our Commissioner of our Streets Department, to share more about this new tool. Carlton?
Thank you, Mayor. Good afternoon, everyone, and thank you for attending today's press conference. We are extremely excited to launch a new tool that will help us in our effort to improve service and trash and recycling collections to the citizens of Philadelphia. Briefly, I want to provide an update, and I'm going to share my screen for a brief presentation to give you an update on where we are and where we've come from since the pandemic began. Okay. So there, as everyone knows, and the mayor pointed out, trash and recycling has been significantly impacted by the pandemic since it began in March. We have problems with absenteeism, and also, more importantly, we saw a 30% increase in residential trash collection. And this is consistent with other cities have been experiencing across the nation. Many other cities have had to alter their services, eliminate recycling, and offer a modified trash collection program. Complicating matters even worse, we've had to deal with severe weather throughout the summer, including torrential rainstorms and excessive heat delays, which cause other delays. The trash collection and the local tonnage has been consistently higher since the pandemic began. What you're looking at in front of you right now is a chart from last year, 2019 in blue, and this year in orange to show how much tonnage the city of Philadelphia has been experiencing an increase since the pandemic began. Again, this is consistent and parallel to what businesses are doing less collections. Businesses is actually down 30% as well. We're averaging on average about 3,000 tons more per week. Some weeks we're as much as 5,000 or 6,000 tons, as you can see in July when the pandemic hit its height. Attendance has also been a challenge. The lines that you see presented in front of you represent what we normally collect. The orange line represents what we normally need to collect trash on an on-time daily collection schedule. The gray line above is what we need during the pandemic with the increased tonnage. And as you can see over the months, our attendance was impacted severely throughout the months of June and July when it hit its all-time low. You can see it's now starting to peak again, and that's thanks to the mayor and the administration's assistance in providing temporary workers for the department. And as we get staffed up to full capacity, our on-time collection percentages will increase. And our goals have been and continue to be to prioritize trash collection over recycling to mitigate the health and safety risks to the public, get back to an on-time collection schedule for trash and recycling, improve absenteeism, and of course to support our workforce who are our heroes on the front lines out there collecting trash each and every day. As I mentioned earlier, we hired actually 150 part-time employees to supplement other full-time employees who either separated from the department, and of course to staff up to 120 workers to be able to get to a full capacity to collect trash and recycling. In addition, our operations have improved. We are one of the first departments, as the mayor said, to use GPS in such a way that it will be able to show our services in real time to the public for trash and recycling collections. We've also done this for paving. We've also done this for street closure permits as well. We've also improved communications and provided opportunities to keep the public informed. We introduced and will be expanding your Curb Your Waste campaign that will allow the public to understand tips on how they should put out their trash to reduce delays and keep our workers safe. 311 complaints have also decreased since the city implemented its plan to hire temporary workers. You can see it was at its peak in July of over 6,000 calls, and it has been virtually reduced to just hundreds for both trash and recycling. And now on to the next phase, which is Street Smart PHL. PickupPHL will give residents a real-time look of where we are with trash and recycling collections throughout the city of Philadelphia. This demonstration will ultimately monitor our trucks on today's schedule. It is a beta form, which means it is in a test phase. We'll be announcing Street Smart PHL to the public. But what it does is it provides real-time information that allows them to look at trash and recycling schedules throughout the day at any given time. This was very difficult for us to communicate without this tool because in certain parts of the city, we may have been on time. In other parts, we may have experienced the delays. And when you're trying to message that to the public, it could get confusing. But with this tool, they're now allowed to see in real time where they are so that they can make appropriate decisions. So now I'm going to launch the actual tool. Okay, and I'm ultimately going to show you in real time what this tool can do. Our GPS system allows us to track every truck that we have out in the fleet today. What you see in front of you are grids and lines and a map of the entire city of Philadelphia. So if I reduce it in smaller versions, you'll start to see the city of Philadelphia map, and all of these lines represent where our trucks are in the city of Philadelphia today. And I'm going to zoom back in. So this is South Philadelphia. This is West Philadelphia, that's North Philadelphia, and I can keep scrolling up, but for the essence of time, I just want to get to the important part of the presentation is what the public can see and what they can do with this tool. If you zoom close in, we'll just choose South Philadelphia for now. The green lines represent rubbish pickup or trash pickup. The blue lines represent recycling trucks on the route, and the yellow lines represent both a recycling and a rubbish truck that have visited on a route today. The says visited, it doesn't actually see collections because we need different type of sensors, and that's the next phase to show an actual collection. But what we do is show visits, and visits gives a good indication that the trash truck has collected on that block in any given day. If we also scroll down and put the collection day boundary, you can also see in these colors, Monday represents light green, today is Tuesday, which shows we were on time, represents a light blue, a darker green represents Wednesdays, Thursdays, and Fridays for orange and yellow, and so forth. If you scroll into the tool a little bit further, you can really get down into the nitty-gritty of where we are with collections. Click on a green line, and it shows you when a truck visited the route, the type of truck that's there, and the time. 9:22 at 20:20 today, this street was visited at 11:52 a.m. I can also do the same for a recycling truck, which shows at 9:22 at 20:20 at 11 a.m. a recycling truck visited the block. The lines turn yellow when both trash and recycling visited the block in the area. So you can see a trash truck visited this block at 12:14 and a recycling truck visited at 11:03. That means both trash and recycling was collected on this block of Sampson Street today, and the services was provided. We think this tool will be very helpful to the public because it will allow them to see, once again, our collection process in real time. The area that you see over here will be used for messaging that will tell if there are significant delays in certain areas of the city, and we can get pinpoint down to the block, or we can give a citywide view across the city of Philadelphia. This will, again, be a helpful tool. It'll provide real-time access, and it will hopefully reduce the number of complaints and calls for miscollection around the city. We're excited to be able to launch this and provide this. Again, we're launching this on October 1st. I would like to thank our OIT division. This system was built in-house. We did not use a private outsourced contractor to build this system. So just a testament to all the talent that we have in the city who can build this type of system. Also, the fleet management for putting GPS on our trucks so quickly, and to use this tool to help improve efficiency and service to the public. Thank you very much for your time this morning, and I look forward to introducing this in the upcoming days for the city of Philadelphia.
Thank you, Commissioner. We are now going to turn it over to Dr. Farley for his updates.
Thank you very much. So here's an update on the coronavirus epidemic. Our daily case counts have been steady in the past week, which is generally good news because we were at new lows last week. Here are the numbers. Since this time yesterday, we've identified 76 cases of the coronavirus infection, bringing us to a total of 35,901 since the beginning of the epidemic. Now, for the past week that ended last Saturday, September 19th, by the date in which the test was run in the laboratory, we averaged 80 cases per day. And of those who were tested, 2.5% were positive. Those numbers are similar to the week before, where we had 71 cases per day and 2.8% positive. And that was the lowest that we'd had since the first week of the epidemic. Now, the lower percentage positivity last week, but the increase in cases is because we had more testing done last week than we did the week before. Overall, about 50% of our cases in the past few days have been either in the 10 to 19 age group or the 20 to 29 age group. And that's reflecting the impact of the college outbreaks we're seeing here in the city. And that's these college outbreaks are occurring all over the country. Now, the colleges have been open 3 or 4 weeks, and overall, the number of cases in colleges has not increased over the past couple of weeks. Schools have also been open, and at least some schools have been open in Philadelphia over the same time period. And good news is that we are not seeing any clusters so far in K-12 schools that have been open during the past 3 to 4 weeks. We are seeing isolated cases in students as well as in staff of those schools, but those are likely people who bring it into the school. We have no evidence yet of any spread within schools. Since this time yesterday, we've identified 2 new deaths from the coronavirus, bringing us to a total of 1,787 since the beginning of the epidemic. Just a reminder that our data on deaths often comes in batches. We average about 1 per day, though. That's what's happening in Philadelphia. Of course, the rest of the state of Pennsylvania and across the United States, unfortunately, case rates are now rising. And that's due primarily to college outbreaks that are occurring across the state and across the nation. At the same time, if you go to Europe, in some countries, they're seeing a surge in cases, which was worse than the wave that they had last spring. And in fact, several countries are now reimposing restrictions that they had first imposed last spring that they have rescinded. A lesson here is that we shouldn't be lulled into complacency about the falling case rates here. This virus clearly has the potential to come back strong. And the best tool we have right now to combat the virus is masks. I'm going to come back to that in a minute. Just an update on testing. We continue to put more information on our website tool where people can search to find testing sites. It's www.phila.gov/testing. You go in there, you can see a map, you can see the locations and schedules for all the sites that offer testing. You can also see the criteria they have, so what you need to meet in order to be tested, whether you need an appointment, whether you can drive through, whether you can walk up, and whether they test children. So lots of information there on how you can get tested. At the same time now, rapid testing is becoming increasingly available through healthcare providers across the city. Because of that, we issued guidance yesterday to doctors about how to use and how to interpret the results of these rapid tests. The main messages to doctors are this, that these tests are good that they're rapid, but they can have false negative results or false positive results. The likelihood that a result is a false negative or false positive really depends on the situation of the person that's being tested at the time. And doctors may need to do a standard test, what's called a PCR test, at the same time to confirm a result to make sure that it's an accurate result. The other message we have to doctors is that if anybody's doing these tests with a rapid test machine, they need to come up with a mechanism to report the results to the health department. We have ways to get results from the standard PCR tests from laboratories that are well developed. We don't have reporting from clinics on these rapid tests. We want those rapid tests reported to the health department so that we can have data to track the epidemic. As you can see, tracking the epidemic and its progress really influences everything that we do in our overall strategy. Just an update on contact tracing. We're continuing, as with other weeks, to report our weekly statistics. We'll be doing that on Thursday. But here's what we're learning from our interviews, that the most common source for exposure for people with this infection is another household member. And the second and third most common sources of exposures are social gatherings, often typically very small social gatherings, and then people visiting other households, which is typically relatives or close friends. One thing that's important that's coming out this is that workplaces are not a common source of exposure. People are, for the most part, being exposed by their relatives or by their friends. Now, we're going to be posting case studies from our interviews to illustrate to people how this virus is spreading. Often just telling a story can give people a picture that numbers itself won't. Those case studies, we're going to remove the identifiers so people won't know who's involved, and we're going to change the names. We're posting our first case study today. It's an example where an initial person was exposed to the virus at a religious service. And then over the next 2 weeks, this virus spread through 4 different households. This household all had people who were related to each other, and they were visiting back and forth across those different households. In total, there were 15 people who lived in those 4 different households. 9 of them became infected. So the message here is that if you have the infection, you go truly into isolation, away from household members so you don't spread it to the people that you are closest to and that you care about the most. And if you're exposed, you should truly go into quarantine away from household members. And for everyone else, you should wear masks even when you're around your relatives and close friends that are not living in your household. Then just a reminder on how to use masks. I talked about this last week. We put out a flyer on how to use masks because you want to make sure you're using it well in order to prevent the spread to you or from you. So with those masks, you need to have a good seal along the bridge of your nose, your cheeks, and around your chin. And that can be achieved through a flexible metal stay that wraps around your nose or an elastic so that it can be pulled tight across your cheeks. You want to have the stretchy ear loops so the mask can be pulled tight to your face. You shouldn't be wearing bandanas or masks that are loose below the mouth. That way, air or respiratory droplets can go in and go out. You should not be wearing masks that have valves in them. Those are used in construction. They're not going to be preventive for COVID-19. And how to wear masks? Very simple. It should cover your mouth and your nose. It doesn't do a full benefit of prevention if it's only covering your mouth. And don't pull it down to talk to the person next to you. That's just the most important time for you to be wearing your mask. When should you wear a mask? Whenever you're indoors with people other than your household members, and whenever you're outdoors within 6 feet of people who are not your household members. Much of the progress we've made in the epidemic is because people are increasingly wearing masks. That's a very good thing. But we're going to need to keep this up, especially as the weather gets colder, people are spending more time inside. So get used to wearing these masks regularly now and get used to wearing them correctly now. More information is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We're now going to turn it over to Armando for the Spanish language translation of the mayor and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el 22 de septiembre del 2020. Buenas tardes. Como pueden ver, el alcalde Kenney no está en la oficina. El alcalde habla desde su casa porque estuvo expuesto a alguien que dio positivo para el COVID-19. A raíz de esto, le hicieron la prueba y los resultados fueron negativos. Aún así, debido a este contacto, él necesita continuar con la autocuarentena y se realizará una nueva prueba más adelante esta semana. Esto es un recordatorio sobre los riesgos del COVID-19 que todavía están muy presentes. Damos gracias que el número de casos positivos en Filadelfia ha disminuido y que hayamos podido relajar muchas de las restricciones impuestas a principios de este año. Pero el virus todavía está aquí y debemos permanecer vigilantes. Por tanto, si usted se encuentra en una situación similar, expuesto a alguien que dé positivo al virus, haga lo correcto. Póngase en cuarentena y hágase la prueba. Esta pandemia, lamentablemente, está lejos de acabar a corto plazo. Y cambiando de tema, ahora quiero resaltar que hoy es el Día Nacional de Inscripción de Votantes. Este es un día festivo cívico no partidista para celebrar la inscripción y participación de los votantes que se observó por primera vez el año 2012. Desde sus inicios, los esfuerzos del Día Nacional de Inscripción de Votantes han ayudado a 3 millones de votantes a registrarse en todo el país. Y por supuesto, este año, este esfuerzo no podría ser más importante. Nuestra propia Oficina de Participación Juvenil lanzó recientemente su iniciativa de inscripción de votantes liderada por jóvenes como parte de First Vote 2020, un esfuerzo coordinado de educación e inscripción de votantes orientado a involucrar a los jóvenes en el periodo previo a las elecciones. El equipo de participación juvenil ha desarrollado una forma innovadora para que nuestros jóvenes incluyan a los miembros de la comunidad mientras mantienen medidas de seguridad y observan un distanciamiento social adecuado. Los embajadores de First Vote 2020 podrán dirigir a las personas a los códigos QR en la parte posterior de sus camisetas, que llevarán a los usuarios a la solicitud de inscripción de votantes de Pensilvania y también a la solicitud de boleta de voto por correo. Recuerde que en Pensilvania la fecha límite para registrarse para votar es el día 19 de octubre. Puede parecer que tiene mucho tiempo aún para inscribirse, pero no debería esperar. Y si planea solicitar una boleta por correo, es especialmente importante que se registre lo más pronto posible para poder solicitar esta boleta con anticipación. Usted puede verificar su estatus de registro de votante e inscribirse para votar visitando votespa.com. Ahora quiero ofrecer una actualización sobre un tema que afecta a todas las casas de la ciudad, y es que es la recolección de basura residencial y el reciclaje. Me complace informar que las recolecciones se han realizado según lo programado durante las últimas semanas y nosotros planeamos mantenerlo así. Quiero agradecerle también a nuestros trabajadores de saneamiento y al liderazgo del Departamento de Calles por su actuación en estos tiempos sin precedentes. Las calles limpias y seguras son una de las principales prioridades de nuestros residentes. Por ello, nos complace anunciar que una nueva herramienta para nuestros residentes está disponible. Brinda acceso directo a los servicios de saneamiento residencial de la ciudad. PickupPHL es un nuevo mapa web que permite ver y rastrear el estado de las recolecciones de basura y el reciclaje. Con PickupPHL, los residentes podrán rastrear casi en tiempo real cuándo se recogerá la basura y se hará el reciclaje en su zona residencial. Esta nueva herramienta demuestra aún más el compromiso de nuestra administración con la transparencia y la efectividad en los servicios en la ciudad. Cuando PickupPHL se lance la próxima semana, será la primera vez que el público podrá acceder al estado de las recolecciones en línea. Y esta es la actualización en materia de salud para el día 22 de septiembre del 2020. El conteo de casos se mantiene estable desde la semana pasada. El día de hoy reportamos 76 nuevos casos con un total de 35.901 casos reportados en total. La semana pasada, que acabó el 19 de septiembre, tuvimos un promedio de 80 casos diarios. El 2,5% de las pruebas resultan positivas y estos números son similares a los de la semana anterior. Tuvimos 71 casos en promedio con un porcentaje de resultados positivos del 2,8%. 50% de los casos en los últimos días han sido entre personas entre los 10 a 19 años de edad o 20 a 29 años de edad. Y esto se ha visto en el impacto de la epidemia en las universidades. No hemos visto un repunte de casos en el grupo de niños entre el jardín de infantes y el 12º grado. Y ha habido casos aislados, pero sin evidencia de propagación. El día de hoy reportamos 2 muertes, tristemente, por el COVID-19. En total, 1.787 personas han fallecido en Filadelfia a consecuencia de este virus. Hemos recibido los datos en grupos. En los últimos 7 días, el promedio es de una muerte diaria. Con respecto al estado de la epidemia en Pensilvania y en el resto de los Estados Unidos, vemos que los casos están en aumento. Los repuntes de casos en universidades continúan y son la principal razón de los aumentos en los casos. En Europa, el repunte de los casos en algunos países ha sido peor que el de la ola de la primavera, y muchos países están volviendo a implementar restricciones. Mi mensaje es que no se deje llevar por la caída en el número de casos. El virus todavía tiene potencial para regresar con más fuerza aún. Nuestra mejor herramienta en este momento es usar las mascarillas. Con respecto a las pruebas, usted puede conseguir toda la información disponible en fila.gov/testing. Ahí encontrará las ubicaciones, los horarios de los centros de prueba, los criterios, verá cuándo es necesario obtener una cita, si ofrecen autoservicio, servicarro o drive-thru y si evalúan o no a los niños. Las pruebas rápidas están cada vez más disponibles y hay nuevas pautas para médicos que se dieron a conocer el día de ayer. Quisiera también compartir algunos datos. Las pruebas pueden dar un resultado falso positivo o falso negativo. La probabilidad depende de la situación de cada persona evaluada. Se podría requerir la prueba PCR para confirmar si alguien tiene el COVID-19 o no. Las clínicas deben reportar los resultados al Departamento de Salud. Por lo tanto, nosotros tenemos los datos. Con respecto al rastreo de contactos, este trabajo continúa y seguiremos reportando las estadísticas los días jueves. ¿Qué es lo que hemos aprendido de las entrevistas? Que la fuente más común de contagio son los miembros de la familia. Que la segunda y tercera causa son reuniones sociales, generalmente pequeñas, o visitas a algún pariente cercano. Los lugares de trabajo no figuran entre las causas de contagio. Estaremos publicando casos de estudio para ilustrar cómo el virus se ha propagado. Obviamente, no se va a identificar a ninguna persona. El primer caso de estudio fue publicado el día de hoy. Una persona que fue expuesta en un servicio religioso. En las 2 semanas siguientes, esta persona contagió el virus a 4 hogares más, todos ellos parientes suyos. 9 de 15 personas fueron contagiadas. Por favor, si usted tiene el COVID-19, aíslese. Manténgase alejado de los miembros de su familia. Observe la cuarentena. Y para cualquier otra persona, por favor, utilice las mascarillas cuando estén cerca de familia y amigos cercanos. Un recordatorio sobre cómo usar las mascarillas. Las mascarillas necesitan cubrir el puente de la nariz, las mejillas y el mentón. Deben doblarse sobre el puente de la nariz y tener un elástico para que la mascarilla pueda ajustarse a su cara. Las mascarillas no deben usarse sueltas debajo de la boca. Y las mascarillas no deben tener válvulas. Sobre el cómo usarlas, nuevamente les recordamos que deben de cubrir la nariz y la boca. Y por favor, no retire la mascarilla ni la jale hacia abajo para hablar con la persona que esté a su lado. ¿Cuándo usarlas? Siempre que esté en sitios techados con personas que no sean de su hogar. Siempre que se encuentre al aire libre a menos de 6 pies de distancia de otra persona. Gran parte del progreso que hemos logrado en la epidemia se debe a que las personas han estado usando las mascarillas y necesitamos seguir haciéndolo, especialmente cuando haga más frío y las personas comiencen a congregarse más en interiores. Así que el llamado es que todos nos acostumbremos a usar las máscaras correctamente desde ya. Juntos podemos ganarle al COVID-19. Cuida de ti y de tus seres queridos, así que utiliza tu mascarilla. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. And as usual, we will start with questions on topics related to the COVID-19 pandemic, including the launch of PickupPHL. If your hand is raised for another topic now, please lower it and we will get to that later. And as usual, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. And today we're asking that reporters please limit their questions to 2 or fewer because we do have a hard stop at 2 p.m. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able. We will now unmute reporters one by one to ask questions on COVID-19. Mitch Blocker of NBC 10, you are up first. Do you have a question on COVID?
I do. Mayor, glad to hear that you're doing okay. How did you discover that you were exposed to COVID-19?
I'm not going to get into the details of who, but it was, how can I say this without exposing anyone? Was in contact with somebody who had tested positive and decided to get tested, and so far it's negative.
Were other city employees exposed?
No.
And how does working from home affect your ability to do your work as mayor?
Well, I'm just talking to you. In this day and age of communication, it's pretty easy to do. Anything that I need to sign or anything gets pushed under the door, and we're going to take all precautions and get through this and move on.
You're home for 14 days?
Yeah.
Even though you tested negative?
Yeah, I believe the new guidance out of Harrisburg is that even if you do test negative, you have to do the 14.
Thank you, sir.
Thank you.
Okay, thanks, Mitch. We're going to go now to Jad Sleeman with WHYY. Is your question on COVID?
Yes.
Okay.
So actually, my question is for Dr. Farley. Let's see. So end of July, I covered a presser where you shared some testing statistics and you talked about southern states opening too recklessly. And you said in conclusion, the second wave of the coronavirus has hit Philadelphia. And at the time, I was skeptical of your claim because when I calculated the percent change of testing and positive cases, it was the same. So 47% increase in testing, 47% increase in positive cases, which seemed to me like, over those past few weeks before that announcement that the virus situation hadn't really changed. And you also said that you explained that the virus started in New York, moved down through Philly and hit the southern states as they were opening too recklessly. And now it's traveled back up and reached us here in Philly as the second wave. At the time, I couldn't find any evidence for that, like any trade winds of like Philadelphians going to Florida or, I don't know, wherever was Arizona at the time. So my question to you is now it's been like a month and change since you announced that the second wave had arrived. And knowing what we know now, you have another month of data, you know how it all played out. Do you think I was right to be skeptical, or were we in fact in a second wave? And can you kind of fill me in on how that played out, what evidence you have for it? Is there any more, now that the contact tracers have been going for a while, is there any more evidence to your southern theory of, these states opened too recklessly and pushed a wave back up towards us? Basically, do you still think that announcement was responsible and scientifically sound?
Well, I definitely called it wrong because I said that the case rates were likely to rise, and they didn't rise, that they fell. I have some comfort that I wasn't the only one. There were people who were running mathematical models that said the same thing. The issue was that there was a big wave that occurred in the south at that time. And, was that wave going to arrive here and have our case rates rise further? Or was it, if it started to fall in the south, would it stay the same here? I expected it would arrive here and case rates would rise, but it didn't. So I called it wrong. Since then, I've been more careful about trying not to predict the future. I think the virus is very difficult to predict. I can't say for sure what's going to happen from here, whether we're going to have, when the weather gets cold, an increase. I can say that most respiratory viruses, they do get worse in the winter, but I can't say that. I can't say what's going to happen between now and then.
Do you think, so at the time, what was kind of bothering me about this, one, because I didn't understand, like how you were basing this, because I saw the positivity rate seemed flat. But like Tony Fauci and all these like feds keep talking about like the second wave is in the fall. And so you said that we were in the second wave at the end of July. So do you worry? I mean, now if like a true second wave in the nature of Fauci and them hits in the fall and we get hammered in October, do you worry that your credibility is going to be, if people are hearing second wave since July, do you think people are going to be less inclined to believe it?
Well, as I said, I called it wrong then, and I think the lesson is that this is very unpredictable. I think everyone would agree that the virus isn't gone. The virus has the potential to come back. And everyone agrees on the basic strategy to prevent that. And so we're going to keep hitting those messages. If the virus case counts go down, that's a good thing. If they go up despite that, that's a bad thing. But I'm going to be more cautious in the future about predicting the future.
Okay. Thank you, guys. We do have a limit of 2 questions for this round. So we're going to go now to Victor Fiorello at Philadelphia Magazine. Victor, do you have a question on COVID?
Yes, good afternoon. Dr.
Okay.
Farley, have you been or do you have any plans to go indoor dining at any Philadelphia restaurants anytime soon?
I do not. It's not. The risk is not worth the benefit. I can get great food by takeout or preparing it at home.
And do you eat outdoors at restaurants or just take out and pick up?
I don't eat outdoors at restaurants. I think the risk is far lower outdoors, but I just don't see a need to.
Great. And just one other real quick question about restaurants. I don't know if you saw Washington, D.C. has come up with a micro grant program to help restaurants order outdoor heaters so that they're able to stay open safely outdoors into the colder weather. Has there been any talk in Philly of doing anything like that that might help our restaurants survive while providing service safely to their customers?
We have not discussed that. There are thousands of restaurants in Philadelphia. I don't know that we could afford to do that. I would encourage the restaurants that have outdoor dining to keep it open as long as possible and have as many people as possible eat outdoors, because I do think the risk is substantially lower there.
Plus, they're very difficult to come by. My understanding is that the manufacturers are way behind in orders. Ironically, I tried to buy a refrigerator last week, and refrigerators were not available. So there's lots of stuff on the manufacturing end that's behind.
All right, we'll just build some campfires outside. Thank you.
Thanks, Victor. We're going to go now to Kennedy Rose of the Philadelphia Business Journal. Kennedy.
Hi, I have 2 super quick questions for Dr. Farley. I was wondering, when will you have your next update on whether you'll increase indoor dining capacity to 50% like the rest of the state, just because it is getting colder quite quickly?
Yeah, sometime next week.
Okay, and my second question is, since indoor dining has been allowed, have you seen any sort of marked increase in cases related to indoor dining at all?
We have not, and we have had our staff going to restaurants both to do education and to do the inspections. And what I'm hearing so far is that restaurants have been compliant as a rule, not all of them, but overall we're pretty satisfied with how well they're following the rules.
Okay, thanks very much.
Thanks, Kennedy. We're going to move now to Laura McChrystal of the Inquirer.
Hi. First, I have a question for Mayor Kenney. I know you said you're not going to specify information on who it was that exposed you to COVID. I'm wondering if you could tell us when it was, in particular, because is there a concern that you were tested too early and that's why you're continuing to quarantine?
It was probably one day last week, and I was told to go get a test by my doctor. So.
Okay, that makes sense. And then I have a couple questions for Dr. Farley. As the nation hits 200,000 cases or 200,000 deaths, is this a sign of, a national failure to contain the virus? And what do you think that the country should do to prevent, another 100 or 200,000?
I do think that the national leadership on this epidemic has been lacking. I think that they have not been leaders, and their messages have been mixed, and that has really harmed our response in the country. And many people have died as a result of it. I think right now it needs to be clear that the federal government needs to be clear that the epidemic is still with us, that the epidemic is still deadly, and that there are steps that we can and should all take in order to prevent the spread. The simplest thing is masks. There's absolutely no reason that we should have a political question about whether people should wear masks. It's a very simple thing to do. It could save an awful lot of lives. And I think we need to be committing to do that as we approach what could be a much more difficult season in the winter.
Okay, that's all from me.
Thanks, Laura. We're going to go now to Jeff Cole of Fox 29.
My questions are not related to COVID, but I'd like to ask them considering how tight we are on time. Can I do that?
Sure, go ahead.
For the mayor. Mayor, the Office of Violence Prevention today has put out a statement saying it's placed on leave an employee that it recently hired who failed to disclose that he had 2 gun offenses. But the office says that it did not do a background check on him because he was moving from one city agency to the Office of Violence Prevention. Is that a problem in your view?
Yeah, it's a problem that he didn't disclose it. Circumstances, from what I understand around the actual charge, had to do with a expired permit to carry. So he had been permitted to have a gun before. He should have disclosed it. He's on leave. He's not being paid, and we'll see what happens when he gets to his court hearing.
Is there an issue about? Well, let me just ask this since I've only got 2. Mayor, should any violation around guns in a city that's had as much gun violence as this one unfortunately has sustained, should any violation around gun possession, should that disqualify someone from working for the Office of Violence Prevention?
Well, the person has been accused of doing this and has to get his day in court. We also hire people in this area that have formerly been incarcerated and have done other things because they have lived experiences that they can extend to some of these young people in the street that we're trying to help and save. So we've had people in our employ that have had past issues with the law, and we'll see how Mr. Hobson makes out with his hearing, and we'll move on from there.
Does failure to disclose disqualify him, do you think?
I would have to check with our civil service regs.
Jeff, we're looking into that now, but just to reiterate what the mayor said, a big piece of this whole violence prevention initiative is using credible messengers, right? Folks who can get and talk to the community in ways that, quite frankly, we can't. I can't defend Morris's decision or his mistake that he made, but this young man is he's a community volunteer and leader outside of his job, right? And that's what he's always been. He made a mistake. His registration wasn't up to date, and he'll have to face his day in court to deal with that.
Thank you.
Thanks, Jeff. We are going to go to Cia Marie Villalobos now of Telemundo 62.
Hola, esta pregunta, Armando, si es posible para el alcalde, si hay la posibilidad de evaluar próximamente con los cambios en los números y también con las temperaturas bajando, alivianar un poco las restricciones y permitir lo que ya permite el Estado de ese 50% de personas dentro de los restaurantes.
This is a question for the mayor, and this is in regards to the possibility of evaluating, given the change in numbers and the change in temperatures, the possibility of loosening up restrictions, especially the 50-person limit in restaurants.
I'd have to turn that over to Dr. Farley. That's a medical and scientific question.
Preferiría que esa respuesta la del Dr. Farley, que es un experto médico y científico. Dr. Farley.
As I said in response to the question, that we will be evaluating our situation now with the falling case counts, and we'll announce next week whether we would go to the 50% limit as the state has.
Como dije anteriormente en respuesta a otra pregunta, vamos a continuar evaluando la situación y vamos a ver si hay una caída de casos la próxima semana para ver si pasamos por encima de las 50 personas en los restaurantes.
¿Las temperaturas van a ser un peso en la evaluación de esos cambios?
Will the temperatures be a factor in the evaluation in considering those changes?
I don't think so, no. It's really the likelihood that the evidence of spread elsewhere with the 50% rule and what our case counts are doing.
No creo que las temperaturas sean un factor a considerarse para tomar en cuenta en esa evaluación, más bien es la tasa de contagio y si se está esparciendo.
Gracias.
Thank you.
Thank you. We will go to Denise Clay now of the Philadelphia Sunday Sun.
Good afternoon, everyone. I had this question for Dr. Farley. If and when the number of the occupancy of restaurants and indoor dining goes up, will that also impact indoor gatherings of other kinds, such as weddings and church services? Will more people be allowed in those venues as well?
So that's a separate category. We would have to make separate decisions about indoor gatherings and about celebrations and events.
Okay. So it's still just 25 people for maximum for an indoor gathering?
That is the rule at the state level and at the city level right now, correct?
Okay. All right, thank you.
Thank you, Denise. We're going to go to Alicia Reed at CBS 3.
Hi, thank you so much. My question is about garbage pickup and it being back on schedule. Seeing that the new app is meant to help people see live where, the process is in their neighborhood, can they also request pickup for large items? And also, can they make complaints on that app, or do they still have to call those in?
They still have to call and use 311 to report any complaints, but the system allows them to actually see if a street has been visited or serviced, and if their trash hasn't been collected, then they can call it in. There may be other justifying reasons why it may have been collected. It could be too large a set out, which leads into your first question about bulk items, which is furniture and heavy things. We do not have a way to report that through this system. We continue to ask residents to call 311 and know the regulations about what they can set out.
And it's currently live, correct? So they can go on there today and see it.
Actually, it will be live to the public October 1st. And so we wanted to give a preview of what it will be when it goes live. There's still some items that we need to work out in the test phase mode.
Awesome. Thank you.
You're welcome.
Great, thank you. We will now move to our second round. If you have questions on other topics, you can raise your hand now. We're going to go to Martin Pratt of Philly, Your Black News.
Question for the mayor or Mr. Alexander. The Cecil B. Moore Recreation Center is being scheduled to not be opened, and actually the community was told that the gates are being locked. And I'm wondering, in this time of violence prevention, and the kids are actively using the Cecil B. Moore field and their park. Is there any comment on why there's the Martin Luther King Recreation Center up there also in North Philly, but that's really only to the two recreation centers the kids have. Is there a reason why this rec center is being locked and not being able to be used?
Kumar, do you have any idea?
No, Martin, this is the first I've heard of that. So let us check on that and get back to you. But certainly, as you mentioned, that will be an issue. I know for a fact personally that center is used heavily, and that playground and that field is also used by that community. So I'll check on that and get back to you.
Appreciate that. And the second question is really around for Dr. Farley. It seems like there's been a real consistent effort from the CDC internally to tell us the truth. Any comment on the recent taking down of the actual facts that they posted yesterday on your site about how COVID-19 is being spread in areas through, as you talked about, through singing, through breath?
Yeah, so, I mean, there is good evidence that political appointees above the CDC have interfered with CDC guidance. And that's very unfortunate because CDC has long been a place where you could go to really feel like you're getting the straight scientific facts, and that's really very, very disappointing. Having said that, what I'm hearing through people who know something about the CDC says that the most recent thing was, in fact, just an error, that something was posted before it was fully edited, and then it was retracted. So in order to be edited, it was more of a process error. The larger point is accurate, though. I'm very concerned about political interference in the CDC. And as far as spread goes, we know that this virus can be spread through respiratory droplets, and I believe that there is increasing evidence that it can be spread to a certain extent airborne, so that they may be able to be spread from more than 6 feet. And that's why wearing masks and ventilation are important.
Thank you.
Thanks, Martin. Again, we're in our second round here. Pat Loeb did submit a question to be read. It's actually about the protest camps, about 22nd Street being blocked. Just wanted to ask, can the blockade if not be cleared even if the encampment stays? So the question is about keeping 22nd Street closed. I don't know if Eva wanted to weigh in on that or Tumar.
Kelly, we're working on that, Kelly, and we should have, we're working on that. I should be able to get back to folks and let them know a final decision on that soon.
Okay. All right. We have one more question from Kennedy Rose of the Philadelphia Business Journal. Kennedy?
Thanks so much. I just have one quick follow-up for Dr. Farley. Going back to indoor dining, increasing capacity, if the city were to move to increase capacity, do you know what date that would happen?
I can't tell you now. I said we might consider it in October. I didn't necessarily say October 1st. I know some people will assume it's October 1st. We'll have to just wait till next week when we make an announcement on that.
Thanks so much. Just wanted to get that cleared up.
Thank you.
Okay. Thank you all for joining us. Seeing no further questions, that will conclude our briefing today, and we will see you all next week on Tuesday. Thank you.